Well, Dr. Sindi van Zyl, also known as the People's Doctor, died over the weekend after battling COVID-19 for a month in hospital. Also a talented broadcaster, Dr. van Zyl gained popularity through her social media platform and talk shows. The medical fraternity has praised van Zyl for her relentless activism around HIV/AIDS and mental health-related issues. Well, to talk more about the legacy of Dr. Sindi, we speak to Bhekisisa health journalist editor-in-chief, Mia Malan. Mia, a very good evening to you, and thank you so much for joining us. And I suppose a good place to begin would be condolences to you and the team at Bhekisisa on the loss of Dr. Sindi. Speak to us a little bit about the kind of work that you had been able to do with her.
At Bhekisisa, Sindi was really part right from the start in 2013 when we started with Bhekisisa, because I met her a little bit before that, 2 years before that, and she really helped to frame my concept and perspective of health journalism. At Bhekisisa, we used her most recently for a podcast series for young women on issues of sex and sexually transmitted diseases and also unplanned pregnancies. And the reason we used her was because she could speak about sex and HIV and mental health in a very non-judgmental way, and also in a way that the average person can understand it. And it was really a great way to use someone in a podcast where they can speak to young women and not make them feel guilty about how to choose contraception, or empower them with the right knowledge to make a good decision when there was an unplanned pregnancy, for instance. And the really special thing about Sindi was that she was a very devoted Christian, for instance, and very religious, but she never expected other people to believe what she believed. So when she worked with these young women and spoke in podcasts, she was objective and gave them knowledge to use to empower them to make good decisions. She didn't ever have her own beliefs interfere with the medical knowledge that she imparted with.
And that's really part of the magic that she was, right? That the issue of healthcare, and in particular women's healthcare, was so close to her heart, and she spent her life advocating for greater access to healthcare, especially for women. Talk to me about some of the examples, and I imagine, Mia, also just the stories of her own experience in personal practice of having to deal with patients who sometimes can't even afford to see doctors, but her seeing them regardless.
I think she was a very flexible doctor. She often told me that, you know, when she started to work in private practice after having worked in the public sector for a long time, she was often taken on by employers in situations where she worked and told that she was spending too much time with patients, because Sindi was the type of doctor who would want to know how many kids a patient had, whether they were mentally happy, and what made them happy, and she spent that time with the patient. The other thing that made her powerful was that she treated patients and also people who asked her questions on Twitter as equals. And that's a very important lesson that I myself learned from her. You know, I learned from her that when you have a mentee or a student, it's much more powerful in that relationship if you treat them as equals rather than people who need to be grateful for you imparting with your knowledge. So when she had patients, it wasn't that sort of like an equal power relationship. She spoke to them and treated them as human beings first, before she spoke to them, you know, just as a medical person. And I think that she was also very comfortable with speaking about her own health problems. She was very vocal about depression. She often mentioned that she struggled with it after her mother died a few years ago. And that made people feel very comfortable. It made them feel they dealing with another human being, not just a doctor, and it helped them to open up about their problems.
And I imagine also just for younger doctors in the field, her honesty about some of her personal struggles, what that in and of itself would do for the upcoming generation. Because, you know, as a doctor, I remember she once said, you know, as a doctor, people judge you. They expect you to have the answers, and they expect you to kind of always be okay. And she let people know that it's okay when you're not okay, but you need to get help.
Yes, I think there's so much power in it when you acknowledge yourself as just a human being and share your own personal problems. And an example of that was when we did the podcast series with Sindi. 4 of Bhekisisa's young reporters, they're much younger than me, they're all millennials, they each presented one of the podcasts. And Sindi then did one program on HPV, for instance, and what do you do if you discover you were infected with HPV. And she spoke about her own experience with that. And as a result, our own reporters starting to ask their own personal questions to her after the podcast. So we didn't just stay, with an interview. She made them feel so comfortable that they could speak about their own reproductive health challenges to her. And that is a very, very powerful thing to have from someone like that.
Well, Mia, you certainly have a duty, and if I may even say a burden, to continue the good work that you had begun with her.
Well, I remember on the 24th of December last year, she WhatsApped me the evening, and she was busy isolating in a house from a family because she felt although she had a negative COVID test at the time, she had many symptoms that she felt was very similar to that of COVID. And she was talking about Twitter that evening, and she was like, please continue tweeting about COVID because people really, really need the knowledge. And so, of course, also tweeted a lot about that. And that was the thing about her. She always sort of made you felt that you were doing a good thing when she was doing much more than you, or exactly the same thing. When you asked for her help, she would make you feel as if you're doing a favor to involve her when you really couldn't do that thing by yourself. So yes, we all have a very big responsibility to try and just in some small way continue what Sindi did.
All right, Mia Malan, we're going to leave it there for tonight. Let me thank you so much for your time and also just for sharing your reflections on Dr. Sindi van Zyl, and may her soul certainly rest in peace.